All right, here's what we would say to you if we weren't afraid to hurt your feelings. We saw this trend going around about people just disclosing the facts and the stuff that we think all the time, but sometimes have to change the wording a little bit to not be offensive. But I want to dive into those. So let's start with, what are your thoughts, Danielle? What comes to mind when you first saw that trend?
I mean this in the least aggressive way possible,
Very
but
Canadian of you.
Yeah.
right. But that random supplement you heard about is not going to cure your IBD.
Yes.
Yeah, we've heard a lot of that over the years.
I think we've heard every single possible
I
iteration.
imagine a new one that we haven't heard of any.
It makes me so angry because there is no cure for IBD. And that in itself is unfortunate because all of us have IBD here. So that just sucks. But then to hear from someone that whatever the heck kind of supplement is going to cure you, that's even more aggravating. So,
And it's usually posed in a way that like maybe you're not doing enough because I've maybe found this solution and you're kind of ignorant for not doing, or you get that, you feel as if that's kind of the way that it's portrayed, and that's so frustrating because then that is fear mongering and that just places guilt where guilt shouldn't be placed. And we hate to see that as not only as patients ourselves but also care providers, people who are trying to help others. Yeah, that's so frustrating.
Yeah, good old wellness shame that we've had around since the 90s.
Yeah.
Started with low fat, and now we're at all the things that you could get cures for. And I feel like, I don't know if this was your experience as well, or both of you, but when you get a diagnosis like IBD, and you first tell family and friends, that's one of the first things that comes up is, have you tried this? Or
Yeah.
and part of that is that people often don't know what IBD is. They think it's the same as IBS, or they think it's the same as having food poisoning, or there's all kinds of weird, distorted thoughts about what IBD is to begin with. But then you also have to deal with not only the new diagnosis, but people sharing things that they read on the internet that are cures. So it's unfortunate.
Yes.
Yeah. And, the second one that comes to mind, or do you want to take the second one, Krista?
Sure. Okay, so similarly, I'm not trying to be aggressive with this, but your doctor shouldn't be expected to be another layer for you. Like they cannot be your dietitian, your therapist, all these other parts of the medical team that we need specialists to be in those roles. And so, yeah, they can't be your dietitian. You really do need to outsource that to specialists.
Yeah. This one came to mind because, a couple weeks ago, I guess, there was some new Texas law that was going to move forward, additional nutrition counseling studies for doctors in medical schools here. But, my immediate thought was, well, we have dietitians for that, number one, but like, how can we expect in the limited time that you have with your doctor already to also be doing, nutrition counseling? It's a big ask, and to stay up to date with all the nutrition related studies in addition to your expertise. It's I feel like the better thing would be to make dietitians more accessible, or there's so many other things that I think need to come first before we do that. It's important for doctors to have some knowledge base around it, but yeah, they don't have enough time to be your dietitian either. We spend an hour with somebody on their first initial intake, and that's just their intake, and then putting together a plan often takes another hour or more. So there's a lot that goes into that.
Yeah. And I think we forget too that sometimes nutrition can almost seem easy in a sense. Yeah, of course. You could just say the basics and let people go. And that might be fine, but to your point, we can spend half of a session on nutrition education, but that's not the full session. That's not the full, treatment and care plan. We spend a significant part in nutrition counseling where we are figuring out what the barriers are and how we can make this work for you. I mean, you can't expect your doctor to be able to do that with the limited time that they have. And you think all the other barriers like insurance and other things that they're battling as well, you need someone else who can really be a partner to you with nutrition.
Yeah, that's why it's a team, and I think there's a lot of beauty in people coming together in their own expertise and collaborating rather than trying to expect one person to do it all.
Yeah. And that's a beautiful thing when we see that in practice. That is the best form of healthcare where we can rely on the doctor in a lot of areas when we really need their specialized care. And then we can have the dietitian in their functional role, a therapist, we can have, pharmacists, we can have everyone working together and collaborating. That's the best. The best.
Yeah, you're gonna have a much better experience when, especially when you have everybody willing to talk to one another and
Yeah.
say, "Hey, what do you think about this? Can you run this? I kind of want to see what are your thoughts?" It's like you're getting anytime you have that team atmosphere, you're getting the collaboration and the expertise is just magnified because you're building on knowledge together as you work with someone, as opposed to kind of staying in your silos. And then the last one that this one was my personal one is this idea that people need to wait until things are stable to see a dietitian. I think I've shared this on other YouTubes before that this happens to us every so often. People will come to us wanting desperately some support around symptom reduction, around getting a plan in place to reduce their risk, but then last minute they get cold feet and back off. And a lot of times they'll say, I just need to wait until things are stable. I need to wait till I get off prednisone. I need to, there's a million reasons, but the thing is like, that's when you need somebody the most. You need somebody when things are at their worst. And I think other dietitians see this too when sometimes people haven't done the things on the list from last time, maybe in a follow up session. So they might cancel and be like, oh, I need to wait. I haven't done anything yet. But that's actually the best time to go see your dietitian because then you can really try to understand, okay, why did it not happen? That's when you
Mhm.
really see results with somebody, when you can dig deeper instead of just always dismissing it. Because you want to understand why you weren't able to achieve whatever thing was on that list so that you can modify it and make it better. And sometimes there's real obstacles that you can work through with that.
Yeah, a patient that comes to mind is one that we almost had this situation, but she ended up hanging on with us and it's been wonderful, but came in with very different nutrition related goals than what we ended up doing because there were surgeries that needed to happen and we needed to go through like revisions and things like that, and we had talked through it. She's like, you know what, I'm going to stay and work through this as we go along, like in the process rather than coming back in 6 months to a year. And I was so thankful for that because now we're getting a chance to like address the dehydration in real time, address like early signs of malnutrition in real time. We're not having to go and backtrack in 6 to 12 months and there's damage done, or we didn't optimize like the adaptation of the gut and things like that. It's really important that we work together during all the yucky stuff to help so that on the, when things are over and maybe there's, more opportunity for stabilization or whatever the case may be, like we can maybe get there faster.
Yeah, that's a really important point in that waiting is not always benign. It's not always
Yeah.
okay to do. Sometimes you really need some support in terms of taking a more preventative approach. I mean, that's why there's a lot of IBD centers and stuff that now have prehab programs, like pre surgery nutrition, as a way to have for people to have better outcomes. And yeah, why wouldn't you want better outcomes after surgery, or why wouldn't you want quicker out of your flare? You want to have preventative type measures and not have it always be reactive.
Yeah. Such a good that, and just thinking about this specific patient, like maybe if you're going into prehab or where you're coming out of a surgery, you're handed a handout, and it says, do this, do XYZ, but that always comes with questions and question marks and just uncertainty, and so in session she's like, okay, well, on my paper it says that I need to have this type of diet, or but like what does that mean, what does that look like if I really struggle with these types of carbohydrates, or I'm so scared of starches right now because they caused strictures in the past. We got to work through all of that in a session. Whereas if that were not the case, she would just be asking questions to Google, maybe, or just like being afraid at her house with this piece of paper. Yeah.
Yeah, that's a really great example. I think that really shows kind of what we're talking about. Basically, I think the bottom line that I'm saying is we're the people that help you get more stable. Like, that's the whole point. If you're not feeling stable, and I get where the sentiment comes from, because I've been in flares where you're like, you're be on prednisone or things feel very up in the air. And I think oftentimes they can feel more up in the air when you're malnourished and you don't have the support or even the path to how to get out of that. It just really amplifies that. All right. So if that's where you are and you need support, you know where to go. Reach out to us on our website and get some support. We have 3 different ways you can work with us listed on our website. And don't forget to like and subscribe. It helps us grow, and we're excited that you're here listening. And let us know in the comments if you'd like to hear us talk about anything else.